I'm Thomas Baldrick at ASH 2014, joined now by Dr. Naresh Permmaraju from the MD Anderson Cancer Center in Houston, Texas. Thanks for stopping by.
Thank you.
Let's talk about mortality from cancer-associated venous thromboembolism.
Great.
What's your study in this area?
So basically what we wanted to undertake the task of finding what's the exact mortality rate in cancer patients suffering from VTE. There have been a lot of conflicting reports in the past. They haven't really been able, they've gotten discrepancy in the results. They haven't really been able to quantify just how deadly or how bad VTE is in cancer patients.
So how did you accumulate this data?
So what we did was, in our large clinical database at MD Anderson Cancer Center, we were able to review the electronic medical record of 9,000 patients that had cancer and had an ICD-9 code of VTE.
Okay, and what stood out to you?
And so our main results that we got was in our cancer population, VTE was the third leading cause of death.
Behind what?
Number one was disease progression, and number two was infection.
And why is determining mortality due to VTE in cancer patients so difficult?
It's difficult because there's a lot of constraints on autopsy reports, death certificate review, just surveillance methods, and just actually having a clinical diagnosis. So that's where the discrepancy lies in these past reports.
So why did you believe it was significant to do this study?
Right, so actually VTE is a major public health issue, with the Department of Health and Human Services estimating about 350,000 to 600,000 patients per year will develop a VTE, and almost 100,000 deaths annually. Now that's in the general population. Cancer patients have a predisposition, well-documented, well-known predisposition to developing VTE. As a matter of fact, almost 20% of cancer patients will suffer VTE throughout their clinical course. So when the incidence is that high in a disease, we want to actually quantify and see just how bad and how deadly VTE is in cancer patients.
Are there any sections or segments of cancer patients that are more prone to VTEs?
Well, in our study, the majority of patients actually that had a VTE attributed to death that were actually solid tumor patients. Okay. Most, the top 1 and 2 were lung and genital urinary cancers.
So what do you do next with all this?
Right, so the next step would be to improve on this data, confirm it, that VTE is significant in cancer patients, and then also to move toward what's the prevention and treatment, because it is a preventable and treatable disease mostly. And so the first thing, we quantify it, that will lead to better understanding, which will lead to more preventative and treatment measures.
Very good. Thank you, sir.
Okay,
thanks for stopping by and sharing
your
information with us.
Yeah, thanks for having me.
Okay.
Thanks.